Hello, let's learn about the concept of learning here in the session about engineering controls to prevent infection. Engineering controls are important for preventing infection in hospitals. The role of the engineering team is crucial in the maintenance of the heating, ventilation, and air conditioning system, that is HVAC system, water supply, building, and the supply lines. Basic requirements of infection environmental controls in infection control is water management, environment management, protection environment rooms, protected environment rooms, and facility management. General requirements for pipelines are for in water management. Proper color coding of the different pipelines like drinking water, RO lines, fire pipelines, and sewage water lines. Up-to-date drawings of the pipelines should be. General requirement for water tanks are cleaning schedules should be available. Records of the date of cleaning, disinfectant use, name of the person who cleaned the tank. The tank should be kept closed, should be marked with details regarding the type of water, the tank's capacity, the last cleaning date, and the due date. It should have a water level indicator and should have safe access with ladder. Sewage treatments limits should be as per the pollution control board. The physical quality should be checked daily. The chemical quality should be checked once in 6 months, and the biological quality monthly. Water analysis for an entry-level hospital, the best practice for analyzing drinking water is once in a month. Checking the residual chlorine levels of the RO water for dialysis should be done after the weekly cleaning at the terminal ends before the connecting to the machine. Introduction level for the RO water for dialysis should be done once in a month. Scrub water should be checked once. Theatre environment should have the zoning done appropriately. Entry should be restricted. Patients should not be brought beyond the red line in the theatre, and transfer trolleys should be used. Theatre staff should wear a proper attire. Operation theatre walls and floors should be free of crevices and cracks. The floor should be seamless with curved edges. This will prevent accumulation of dirt and organism and will be easy to clean. Cleaning records should be maintained. It is mandatory for full NABH accreditation to have the following in each operation theatre: individual air handling unit for each theatre, laminar flow and highly efficient particulate air filters in case of ultra clean theatres, air changes, positive pressures, relative humidity, and temperature should be monitored and documented daily. The air conditioning system should not be switched off and should be maintained with the variable frequency devices and the blower to prevent spore formation. The integrity of the filters and the system should be checked every 6 months. HEPA should be changed if the particle count is high. The pre-filters at the air handling unit should be washed every week and maintained appropriately. Records of checking should be maintained. For entry-level certification, split AC system and window AC are permitted in theatres. The filters of the window AC should be cleaned weekly and units should be maintained weekly, and the process should be documented. Protective environment rooms like burns unit, transplant unit, and isolation unit should be planned and constructed as per the norms. Air conditioning requirements like positive pressure in case of transplants or burn units and negative pressure in case of isolation units should be provided. Isolation requirements. If isolation units are not available in the hospital and patients with airborne infection are admitted, and to prevent the spread of infection, each patient should be placed in single or private rooms with closed doors. Patients with the same illness can be cohorted in the same room. There should be no central AC supply in such any rooms. Each room should have separate air conditioning unit, that is window or split or non-AC rooms. Isolation requirements in a block with central AC. The door should be kept shut. Windows should be open. Inlet and outlet AC ducts should be blocked. Powerful exhaust for airflow from the outside to the inside room and in and out through the window, and when the door is open should be available. What are the infection control guidelines for the mortuary? The requirement is that a separate area should be designated as a mortuary and should be kept under lock and key with strict access control. The facility should be clean. It should have cold storage with temperature monitoring and power bank. Mortuary staff should perform hand hygiene and wear adequate PPE. The biomedical waste should be as safely segregated and disposed. Mortuary should be free of any pests and rodents. The entire process. Regarding biomedical waste management, any waste that is generated during the diagnosis, treatment, or immunization of human beings or animals, or in research activities is called as a biomedical. Which is generated during the patient care in a healthcare setting in the biomedical waste, and it can cause health problems to the healthcare professionals who handle it and pollute the environment as well. So, proper collection, storage, transport, and disposal of the waste is important to control or minimize the risk of infections, injury, and toxicity. So what is the 3R approach to biomedical waste? One is reduce, reuse, and recycle. Reduce, that is prevent the wastage of products. Reuse the single-use items after proper sterilization, and recycle, that is send the hazardous items for recycling. Remember that the biomedical waste rules of 2016 do not apply to radioactive waste or hazardous chemicals or solid waste or lead acid batteries or hazardous or lead acid batteries or e-waste and hazardous microorganisms. Examples of biomedical waste includes the infectious waste, chemical waste, sharp waste, cytotoxic waste, and infected waste. So this is the sinuses of biohazard symbol and sign. Handling biomedical waste, all healthcare professionals handling waste should be wear personal protective equipment like cap, mask, apron, goggles, gloves, and boots. After handling, they should perform hand hygiene with. We'll look about the antimicrobial resistance. Antimicrobial resistance is like a serious silent killer pandemic going on. Minimizing the emergence and spread of multi-drug resistant organisms helps in preserving the effectiveness of the existing antibiotics. Every hospital should have their own antibiotic policy, essential for empirical therapy, prophylaxis, and definitive therapy. There should be a periodic review of these policies and timely updates. The treatment guidelines should be used as a guiding document for all the clinical. The primary aim of this policy should be to minimize the mortality due to antimicrobial resistant infections, preserving the effectiveness of antimicrobials, and this can be achieved by selecting the patient who needs to be treated, having all the antibiotics available, and avoiding unnecessary antibiotic usage. That is, right drug for the right body. So, the next thing is outbreak management. What is an outbreak? Outbreak is an occurrence of infection at a rate greater than that what is expected in a specific geographical area and over a specific time. Outbreak can be detected using surveillance techniques such as passive surveillance, active surveillance, sentinel surveillance, syndromic surveillance, and others. Passive surveillance that is collected, the data is collected using monitoring routinely collected using health data. Active surveillance means actively the health data is obtained from. Sentinel surveillance is selected groups provide healthcare data. Syndromic surveillance that is monitoring the health syndrome. After this information, hospitals should form and train rapid response team, conduct periodic review of data, update the plan, identify outbreaks, arrange necessary drugs and resources, setting the diagnostics, setting liaison with the other healthcare system and first step will be to confirm the outbreak, and then after confirming, compare the current data with the baseline data of that population of the particular area. That provides an information of the confirmation of the. Then determine the hypothesis. What is the likely cause of outbreak, and document the hypothesis and hypothesis confirmation. Then please confirm the hypothesis and proceed for the management of outbreaks. Thank you.